Psychotic experiences are pretty common in the general population, but it is quite hard to know how prevalent they are, because it depends partly on the way that they're measured.
Having psychotic experiences earlier in life was actually a relatively poor predictor for adult psychotic disorder, although prediction was better when we looked at more distressing or more frequent adolescent psychotic experiences.
That's Dr. Sarah Sullivan and Dr. Stanley Zammit, who will talk about their research on the occurrence of psychotic disorders in children and the prediction of psychotic disorders in young adulthood. Their work appears in the April 2020 issue of the American Journal of Psychiatry. I'm Michael Roy, Executive Editor of the American Journal of Psychiatry, and this is AJP Audio. Dr. Sarah Sullivan is affiliated with the Center for Academic Mental Health at the University of Bristol. Her research has looked at the relationship between duration of untreated psychosis and clinical outcomes, as well as risk factors for violence and self-harm in first episode psychosis. She is currently using routine electronic health records to develop and validate a prediction model for risk of new-onset psychosis. Professor Stanley Zammit is a professor of psychiatry at the University of Bristol and at Cardiff University. His work is focused on the epidemiology of psychiatric disorders. He's interested in the development and trajectory of psychotic experiences in the general population, and in how genes in the environment, particularly exposure to traumatic experiences, lead to the development of serious mental illness. Dr. Sullivan, Dr. Zammit, hello and welcome to the podcast.
Hello.
Hello.
Now, your article begins by noting that people may have psychotic experiences that are external to a full psychotic disorder, and people who have these experiences generally do not seek out medical care. Although these psychotic experiences are typically transient, they can be upsetting, and research has shown that they can affect a person's ability to function and also can lead to thoughts of suicide. So first, could you talk about how common psychotic experiences are in the general population and about the burden they place on public health systems?
Yeah, sure. I'd be pleased to answer that. So, psychotic experiences are pretty common in the general population, but it is quite hard to know how prevalent they are, because it depends partly on the way that they're measured. So there are two main ways to collect information on these experiences, either with a self-report questionnaire, which tends to overestimate how common they are, as research shows, or a semi-structured clinical interview, which allows the researcher to ask further probing questions to establish whether an experience is really genuinely psychotic or more part of normal experience. Measured by these semi-structured interviews, about 5% of people, so they've had one of these experiences over the previous 6 months. And regarding the burden on clinical services, because most people who have these experiences don't seek any help, our research shows they're not a major burden on clinical services, but many people who report them either have other mental health problems like depression or anxiety, and also these experiences are associated with a reduction in functioning in some people, so they may, for instance, underperform at school or university and have fewer poor quality friendships.
So thank you for that background information. It would seem that there is a need to understand how the beginning of psychotic experiences may evolve to a clinical disorder, and to do a better job of identifying those people who are at high risk. So what is currently available in terms of services to identify and treat these individuals?
Well, it's important to stress that although psychotic experiences are strongly associated with later psychotic disorder, most people who have such experiences do not go on to develop a clinical illness. Historically, we've been quite poor really at knowing who of those people reporting psychotic experiences will actually go on to develop a disorder, although we are working on trying to improve this here at the University of Bristol. In the UK, there are specialised clinical high-risk services, which are either standalone services or part of early intervention services for psychosis. And the aim really of these services is to monitor people who are considered to be at high risk on the basis that they've sought help for perhaps mild or transient psychotic experiences, and to provide psychological therapy to prevent them transitioning to clinical disorder, although the ability to provide this actually varies greatly because of service financial constraints. There's also some research showing that only a small percentage of people who are taken on the caseload of early intervention for psychosis teams have come through the high-risk services in the UK. suggesting that there is a need to improve our ability to identify people in the general population who are at higher risk of developing psychotic disorders.
I think that's a nice transition to your article in our April issue. Your study aimed to investigate the incidence, course, and outcome of psychotic experiences from childhood through early adulthood in the general population, and to examine how well predictive tools work to identify psychotic disorder. Could you describe how you planned to achieve these goals?
Yeah, sure. So our study uses data from a birth cohort based here in Bristol in the UK called the AVEN Longitudinal Study of Parents and Children. So initially the study recruited about 14,000 pregnant women in the southwest of England between 1991 and 1992. We followed up these women, their partners and the children resulting from those pregnancies very intensively over the previous 27 years, which has allowed us to examine the onset and change in psychopathology across childhood, adolescent and early adulthood. This study, which has been funded by the UK Medical Research Council and through collaborations with other universities in the UK and Ireland, we've collected data on psychotic experiences from the study children at 3 time points so far, when they were 12, 18 and 24 years of age most recently. And we have done this using the semi-structured interviews I was talking about previously, which is called the Psychosis-Like symptoms, or the FLICS interview. What this tool does is assess 12 of the key psychotic positive experiences, like hallucinations, delusions, and experiences of thought interference. And then we've used the data we've collected using these methods to estimate incidence or new onset of psychotic experiences across these ages, and also to examine how useful measures of these experiences in childhood and adolescence are for predicting the onset of psychotic disorder in adulthood. That's what we've been doing.
Okay, well, so let's get to the results of your study. Something that caught my eye was the number of individuals who, at age 24, reported that they had a suspected or a definite psychotic experience since age 12. So out of more than 3,800 participants in your study, almost 500 reported having one of these experiences, or about 13% of the sample. And this is depicted in a flowchart in Figure 1 of your article. So first, were you surprised by the number of participants who reported having these experiences? And second, what kinds of experiences were reported?
Well, that figure does sound like a large proportion of the sample, but it does include experiences that were not definitely psychotic, but which the interviewers thought were likely to be on a spectrum somewhere between normal experiences and psychotic ones. So the percentage who were rated as having a definite psychotic experience was around 10% since age 12, which wasn't that unexpected. It's fairly consistent with some of the previous literature out there. And most of those people actually reported only infrequent or rarely occurring experiences. So the proportion with frequently recurring experiences was much lower. With regard to the type of experiences that were reported, the vast majority of these, about 90%, were auditory or visual hallucinations, whilst delusions or experiences of thought interference were much rarer. Although part of the reason could be that it's actually more difficult to tease out whether beliefs are psychotic or not compared to whether experiences of hearing or seeing something meets criteria for being psychotic.
You also reported that there was a peak of these experiences around ages 17 to 19. Is there a reason why this time of life seems to be significant?
Yeah, the peak in these experiences occurs a few years earlier than the peak in clinically diagnosed schizophrenia, for example, which is the peak is about 22 years in men when they're 22 years of age, and so 27 to 28 years old in women. It might be that the experiences that we're measuring in our general population sample are mirroring the rise in attenuated psychotic symptoms that are often present for a few years before a clinical diagnosis of a psychotic disorder is made. A number of explanations have been put forward to explain the sharp increase in incidence of schizophrenia that we do see in late adolescence and early adulthood. For instance, the increase in social demands from having to live independently at that age, and biological explanations like disruptions in synaptic pruning that also occur at this time. These explanations are also likely to apply to the incidence of psychotic experiences in the general population too, even though the vast majority of these are transient and will not develop into a psychotic disorder. And lastly, the peak in incidence that we observe for psychotic experiences in late adolescence is very similar to that seen for depressive symptoms, and therefore it's possible that the rise in psychotic experiences that we see is driven by a corresponding increase in depression or other types of psychopathology at this age.
As we mentioned earlier, another goal of your study was to look at the prediction of having a current psychotic disorder by age 24. You checked this using self-reported and interviewer-rated tools of psychotic experiences during childhood and adolescence. What did you find here?
We found that having psychotic experiences earlier in life was actually a relatively poor predictor for adult psychotic disorder, although prediction was better when we looked at more distressing or more frequent adolescent psychotic experiences. The interviewer-rated measures generally performed better than the self-report measures of psychotic experiences as predictors, although that difference was no longer so apparent once we also included information on frequency and distress of the psychotic experiences, which I guess suggests that the self-report measures are probably a reasonably good, cost-effective approach to collect data for prediction of psychotic outcomes. However, as psychotic experiences on their own weren't good predictors of later psychotic disorder, we are conducting other studies here in Bristol to look at what other measures might perhaps be usefully added to the psychotic experience data to improve prediction of psychosis.
And you also wrote that 30% of participants who met the criteria for a psychotic disorder had not sought professional help, and that this indicates a significant and important unmet public health need in adolescents and young adults in the general population. What might this mean for the practicing clinician and other mental health professionals?
Well, the main implication of this finding is really that a population health concern that about 1 in 100 to 150 young people have not sought help, even though they have psychotic experiences that happen often and cause them substantial distress or affect the way that they function. Primary and secondary care clinicians perhaps could ask more often about these experiences in young people who present to their services, particularly if they are presenting because of a mental health or substance use problem. And in this way, we could perhaps ensure that opportunities to identify and refer people with psychotic disorders to specialist services are not missed.
Are there any limitations of your study that may affect how your conclusions are interpreted?
Probably the main limitation is that whilst our study is one of the largest of its kind, it's still too small to really precisely predict rare outcomes such as psychotic disorder. So there's less certainty around our estimates of incidence and prediction than we'd like there to be. Also, as is common in most longitudinal studies where people are followed up over a long time period, there's a substantial amount of attrition as people drop out of the study over time. And we know that the people who drop out of studies in general are those who are most unwell and those who come from the most adverse background. So this may have led to some bias in our results, although we did use statistical techniques such as multiple imputation to try and correct for this. And then I guess a final limitation is that we weren't able to determine the incidence of psychotic experiences before the age of 13 because we lacked the necessary information to do that. So we couldn't really examine how the incidence of these experiences changed from childhood into adolescence.
And finally, what do you think other studies should explore regarding people who experience a first episode of psychosis?
Well, the main area of uncertainty that studies could look into in the future is about some of the mechanisms by which established risk factors for psychosis, like genetic risk or exposure to childhood trauma, lead to someone hearing a voice or developing a delusional belief. But for this, you really need longitudinal data, such as the data we use in our study, with repeated measures of these exposures and of the outcomes, and also potential mediators. For example, data on specific cognitive biases or psychological mechanisms that could explain the onset and the persistence of psychotic experiences for some, and also help to identify targets that we could modify in order to achieve prevention, which is always the ultimate goal of this kind of research.
Dr. Sarah Sullivan and Dr. Stanley Zammit, co-authors of an article in our April issue on the onset of psychotic experiences in childhood and prediction of later psychotic disorder. Thank you both for speaking with us.
Thanks.
Thank you very much.
This concludes this episode of AJP Audio. You can rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. Please also visit our website, ajp.psychiatryonline.org, to check out trending articles, find CME courses, and watch videos highlighting some of our other articles. APA Publishing has other podcasts you can listen to. Psychiatry Unbound is the books podcast from APA Publishing. It's hosted by Dr. Laura Roberts, editor-in-chief of APA Books. Also check out From Pages to Practice, which reviews the latest research published in the journal Psychiatric Services. It's hosted by Dr. Lisa Dixon, editor-in-chief of the journal, along with Dr. Josh Beresin. You can subscribe to these podcasts on Apple, Google, Spotify, or on any of the popular platforms. Next month in AJP Audio, we'll talk with Dr. William McDonald of Emory University about the clinical application of psychedelic drugs in psychiatric disorders. We hope you'll join us too. Thank you for listening.